Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 13 of why you can still have back pain. In this video, the hidden secret number 13 is due to vertebral misalignment, or misalignment of the bones in your spine. Your spine has 24 bones called vertebrae, and each of these vertebrae are movable. They can rotate, they can bend to the right and the left, and flex and extend forwards and backwards. There's actually 6 degrees of freedom, or 6 different motions that each vertebrae is capable of doing. And in between the vertebrae are the spinal nerves that exit the spine to go to different parts of the body. So this is a plastic model of a spine. The vertebrae here are separated by a disc, and in between the vertebrae, these little yellow spaghettis that are coming out are the spinal nerves. And if you have a misalignment in the spine, what happens is that it can press on the nerve, pinching the nerve and causing pain. And that can occur up in the neck area, in the mid-back region, and even in the low back region. So if the vertebrae is rotated out of alignment so much as a couple of degrees, that can cause pressure on the nerves, causing pain. It only takes about 25 millimeters of pressure on a spinal nerve to cause pain. So how much pressure is 25 millimeters of pressure? It's approximately the weight of a quarter in your hand. That's not a whole lot. The bone in your body, bone is the hardest tissue in the body, and nerves are the softest tissue. So when you have the hardest tissue going up against the softest tissue, the hardest tissue is going to win every single time. So these misalignment problems, they're very, very common. And how are they diagnosed? Well, a doctor of chiropractic, such as myself, what we do is we do a physical examination where we use our hands to palpate the vertebrae and check to see how they're moving, to see if they feel stuck or they just can't move anymore. The vertebrae should move, they should glide back and forth very easily between each other, and they should feel kind of springy. And if they feel stuck like an old rusty hinge that needs a squirt of WD-40, that's not good. That's going to cause all kinds of problems. And then also, if the vertebrae is stuck out of alignment, again, that will cause pressure on the nerve, causing damage to the nerve and causing pain response. Another way that we check for misalignments of the vertebrae is through the use of X-ray. And I don't X-ray everybody. I only use it if I feel that I need to find out what's going on, if there's something I can't find out during the regular examination. We also use X-ray to count segments and look for pathology and look for degenerative changes such as arthritis or wear and tear on the joints or in the discs that separate the vertebrae. Now, additionally, in the examination, we do a series of orthopedic and neurological tests, which can also give us further information as to the health of the joints in your spine and to see if you have any pressure being placed on the nerves that can cause these back pain problems. In my office, I use a very specific way of analysis and detection of these misalignments, and it's called mass correction. And MASS is an acronym that stands for motion, alignment, and strength. And the first thing that I do is check for motion problems. I check for motion problems in the joints and motion problems in the muscles. The bones don't move themselves. Muscles move bones, and ligaments hold bones in place. So we have to check for the movement of the vertebrae to see if there's any kind of misalignment things or abnormal motion problems. The second component is to check for alignment. And I check alignment more globally than segmentally. What that means is that I will check to see the global position of the cervical vertebrae here, or the thoracic vertebrae here, or the lumbar vertebrae, and how they interact with each other, rather than looking at individual vertebrae. The spine is a kinetic chain, and just like with any other chain, you can't move just one link of the chain. When you pull on one link, the rest of them follow. So we have to look at the alignment issue globally by looking at the posture, and also taking a look at the pelvis to see if it's imbalanced, to see if you have a high hip or if it's rotated on either side. And that will help us to eliminate a lot of the causes of back pain. And finally, the last part of mass correction is strengthening. So once we've restored motion and alignment to the spine, I prescribe specific exercises that first stabilize and then strengthen the spine so that your adjustments hold and you stay out of back pain permanently. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions about vertebral misalignment or back pain, please feel free to communicate with me through my website at redapplewellness.net. Please also subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.